Welcome to our program Consciousness in Evolution, a project from Reaprendencia International created to discuss interesting themes of conscienciology such as re-education, paranormal experience, and personal evolution. So wherever you are, good morning, good afternoon, or good night. You can find our page, Reaprendencia International, at YouTube, Facebook, or Instagram. Today we have two special guests, two sisters that were born in Florianópolis, Brazil, and they will talk about self-care, which is a continuous and dynamic cycle of self-awareness, deeply influenced by culture and personal health model. So, welcome Fernanda Cabral Schweitzer. She is a physician graduated by the Federal University of Santa Catarina, specialized in occupational medicine by Brazilian Medical Association and National Association of Occupational Medicine. She currently lives in Foz do Iguaçu, Brazil, where she manages the Occupational Medicine Division of Itaipu Binational. She has been a volunteer and a researcher for conscienciology since 1999, and currently she volunteers at AIEC, which is an institution dedicated to the expansion of conscienciology. Welcome, Fernanda.
And thank you so much.
We also have here Mariana Cabral Schweitzer, which is a nurse. She has a PhD in science by the University of São Paulo and the Catholic University of Portugal, and also a postdoctorate by the School of Nursing of the University of São Paulo. She is also specialized in acupuncture by the Faculty of Health Technology in Shandong University. She also has a specialization in public health. She lives in São Paulo, Brazil, where she's an assistant professor at the Department of Preventive Medicine of the Paulista School of Medicine. She's been a researcher in conscienciology since 2013, and she currently volunteers at UNICIN, which is an organization that oversees all conscienciocentric institutions. Together, they authored the book Self-Care, which is a dynamical approach to integral health, besides articles and entries to the Encyclopedia of Conscienciology. So now, the stage is yours, girls. Go for it.
Thank you, Anna. Thank you very much for your great introduction of ourselves. And it's a pleasure to be here and be in the program and to be sharing this book with everyone. So we have the book here in paper. So we'll talk about a little bit about the tools that we have in the book, the process of thinking self-care, health and care as concepts, how they evolve during the different times in society, and the book link is available for everyone. And if you want to, you can find the tools we'll talk about at the book website. So if you don't want to buy the book, don't worry, we have this tools available for everyone. The blog is in Portuguese and also in English, so you have the material in both languages, and you can also find some of our previous publications, our scientific articles that maybe help if you're interested in self-care or in this area of knowledge. So thank you very much.
So how this idea of talking about self-health came to you guys?
We began studying health, me as a physician, Mariana as a nurse, and we began to discuss some situations, some cases, our view about some patients, and then we perceive we are used to some self-care tools and strategies because we learned this in our family or because we learned this in our studies, then usually people don't get access. So how do you, for example, use Occidental medicine and also integrative and alternative complementary practices together. This is something, it's not even not usual. Then we decide to bring this more like more materialized for people, and this got transformed in. We spent 5 years writing the book, and now that first in Portuguese and 1 year later in English, so people could access this without having to go to somebody's a professional who understands health like this in this way. Or if you are a professional, you can also use these tools and this method we propose in the book, the FEMA method, to offer this integrative health to your patients, clients. This was a transformation for us.
I find it really interesting because myself, as a physician, and later I graduated in nursing as well, and I didn't have this dimension of care during the time I was a physician. We don't really learn that in a graduation in medicine. The level of care that the nurses apply to the patients are uh, completely different. It's another perspective, and it gets the patients to engage in their treatment a lot more. And I feel like in the US, the model of medicine leaves the physicians a little bit like isolated with the patient. And the nurse is the one who does the teaching and all the information and how to change the lifestyle. We are very lucky in Brazil that the physician gets to do that if the physician is really interested, because there are the ones that don't really bother about that. They just prefer to prescribe a pill and that's it, and don't talk about lifestyle or about conditions of sleep or food or anything like that. So I would like you guys to proceed and explain what you put in this book, because it's a very interesting topic.
Thank you very much. And it's interesting because last year we had the opportunity to start to teach about this method and these tools in the undergraduate courses here in the university where I teach in Brazil. And we have been starting to see this movement with undergrad students from medicine, nursing, and other courses. So I think it's very interesting that we are exposed to this idea of self-care while we are still in undergraduate studies. And this year we are teaching physicians and nurses and healthcare practitioners about the method and the tools also. And it's interesting to see how even as after we start work, we still need to be remembered and invited to reflect about self-care. So it's very interesting to see this movement. And I think we have a question, is that right? Because I can answer.
Yeah, go ahead. Feel free to answer.
Maybe we can start our presentation because I see everybody's interested in this idea of integrative health. So this would be the topic, the better way to call it, what we intend to talk about when we think about this idea of health in an integral way. So maybe we can start with our presentation, and then our public here and everyone that watches our presentation afterwards can understand how this process occurred. So I think maybe that's a great idea. So this is the title of our book, Self-Care, A Dynamic Approach to Integral Health. And it's very interesting because we have been working on this, as Fernanda said, for last 5 years. And it's interesting to present always the principle of disbelief. So please don't believe in anything, not even in what you hear in this webinar. Experiment, have your own experiences. And if you want to, share with us later. So feel free to contact with us. And to start, it's always interesting for us to invite everyone to think what is health and what is care. especially because if you have a different background, if you are from a place where you have access to Oriental medicine, as we say, traditional Chinese medicine or Ayurveda medicine from India, you have an idea of what is health and what is care. Or if you're from Brazil or from the US, or as I was recently in Canada, so if you have different backgrounds, you have different conceptions of what is health and what is care. And what we want to invite you is to maybe think a little bit, like 1 or 2 minutes, of what it is are these concepts for you. And we'll talk about how these concepts have evolved during our time in society. And this is the bookmark we did for when we took the book to an international event in India. So this was the bookmark. So just to explain the picture here. And I will invite everyone now to think about these concepts of health and care during different periods of time. So here you can see at old age that we have started to think about medicine and health and care from different cultures. For example, traditional Chinese medicine that has over 5,000 years, or Ayurveda medicine or Ayurvedic medicine that has even more time, 6,000 years, or Tibetan health or medicines that you have today still being in practice. They have concepts of health and care that includes the diet, exercises, meditation, and exercises with your body. For example, Qigong, Tai Chi Chuan, they are from this idea of traditional Chinese medicine. You have the doshas from Ayurvedic medicine, and you also have this concept of energy. So if we look back in time, we will understand that these concepts of energy and food and diet and exercise are included in these ideas of health and care. But this changed a little bit over time, especially when we go for magical thinking, when we go to Greek, old Greece, and then we have an exposition about health and care, including not only exercises and also diet, but also the idea of health that is possible for everyone. Let's say the panacea that we also very much wanted during the pandemic, a special pill that could cure everything. And hygiene, so important when we think about these last 2 years that we have been during the pandemic times. And these concepts were very strong during this period of Greece. And then we have the extreme opposition of this when we think about Middle Age and when we start to think about religion controlling the concepts of health and care, and the idea of health maybe as something good and the disease as something bad. That's something that you're being punished from, or something that you're not worth it. So it's interesting to see how strong these concepts have changed in the Middle Ages. And of course, we evolved to the Renaissance and also the Cartesian influence when we think about modern age and how we start to think our body as a machine. So we only have pieces that we need to fix. And this was very important because it was the extreme opposition of this idea of religion, but also it has some difficulties. For example, in this image, in this slide, you'll see a body that doesn't have any head. So emotions, feelings, energies, they were not included in this concept of the modern concept of health and care. And what we see is that we start to get better care with control of infectious diseases, and the idea of not only single cause models, for example, one bacteria, one disease, but including the social, the conditions of work. This all is very important to understand the healthcare process. So we see this, everything has changed, especially now in the contemporary age. So we have multi-cause models, we have an epidemiological transition where we have control of infectious diseases and new ones that are very challenging for everybody, but we have vaccination, we have a great amount of chronic diseases that invite us to rethink our concepts of health and care. So we need to broaden our concepts. And this is especially important because WHO, the World Health Organization, has been inviting us to broaden our concept of health and care since the 70s, when they invite everybody to rethink the inclusion of traditional medicine in the national health systems. And especially here in Brazil, since 2006, we have over 29 complementary therapies included in our national health system that invite us to rethink these concepts of health and care. And especially today, after 2 years of the pandemic, we know how important it is to think of health as one health, including the health from the animals, the health of the environment, and also the health of ourselves, the human beings. So if we look at the timeline in the beginning and in the end, we see that we are in the same place that we started, because we need to consider these broadened concepts of health, disease, and care. So this is like a 5-minute evolution process of the concepts, but I think it's really important because this is where we come from today to present these materials to everyone here. So it's very interesting to see that in the whole world, the WHO, the World Health Organization, has been producing different materials like this atlas, where they identify the most common traditional medicine that are being used today. And we can see that acupuncture, it's the top one in the whole world. So we have here in Brazil for free, including the national health system. I did go to China to study, and I've seen there, and I've seen many places where they have acupuncture. Fernanda and I, we did go to India in the beginning of this year, and we did see lots of experience with Ayurvedic medicine in India. And of course, many other complementary therapies as chiropractic, phytotherapy, that is the use of medicinal plants, homeopathy, naturopathy, osteopathy, and there you go. It's a long list of complementary therapies. And here in this small table here are the 29 complementary therapies that are included in Brazilian National Health System. Today, to everyone that lives in Brazil that can access the primary healthcare units or hospital centers or specialized centers in traditional medicine. So you can see how big this movement has been in the last 20, 30 years and how much evidence we have since then. So this is very good. And I think many of people here that maybe listen to us have been using these practices over their healthcare process. So it's interesting to see how these have changed and evolved. And this is particularly interesting when we think about how much the body of knowledge about consciousness has also grown. So we have been knowing more about these practices, these complementary therapies, but also we have been studying the subtle energy and biofield healing process. And I want to talk about a little bit about this document. This is the Consciousness and Healing Initiative, where they identified many places in the whole world that have been studying consciousness and the biofield healing process, subtle energy. And of course, there's the consensual paradigm, where we understand that we have a holosome, different bodies, in a multidimensional idea of the world with different spaces and the series of lives. So we need to consider all these elements, these ideas, to understand what is health and what is care for us. So this is particularly
important.
Just
a second, Mariana.
Mm-hmm.
So before, we used to understand that health would be like the absence of a disease, and that we can use Western or Eastern medicine to cure the diseases. And I would like to go back to the question where someone asks that if it's correct to say that Oriental medicine is, or should we call it another way? I believe you can include Oriental, in Oriental medicine, you can include traditional Chinese medicine, Ayurvedic, but certainly you know a lot more than this than I do.
Yes, we can
What do
include
you think?
all of these practices in a way that is not only Oriental, because if we think about our indigenous communities in America, North America, South America, Central America, we will have these concepts of integral health. They will bring to us this idea of the environment, the health, care, energy, the concepts of energy. So it's not only Oriental medicine that invite us to think about an integral way of taking care of ourselves. So we have different approaches. So this is why today this concept of integrative health or integral health or integrative medicine, they have been more used, and it is more common to find. So this is why we choose in the book to call integral health. So it is from the integrative health or integrative medicine. And especially Fernanda can talk a little bit more about this, because she explained a lot about what it is consensual health. That will be another idea of understanding this approach of integral health. So what do you think? Let's share with them, Fernanda.
Sure. Oriental health or Oriental medicine is a very big concept, because we have a lot of different practices, and you can use this, but it depends what you mean. If you mean integrative health, it's better, or complementary health, it's better to use these concepts. But if you want to mean these medical systems from the Orient, that this is okay, this is correct.
We also have another question from someone that is asking, what is apitherapy? Does it have something related to bees?
Yes, people.
That's something I've
It's
never heard.
intuitive, right? Yes, it's the treatment, but not with the bees, but with the honey
Oh,
or
okay.
the products bees produce.
Interesting.
Yes, it's very interesting.
And I believe in terms of consciential health, there is an important concept that we should maybe explain a little more to the public here, which is the epigenetics. I believe it's when you integrate the genetic with the environment as well, something like that.
That's true, because we have our genetics we receive from our family, but how does it manifests in this dimension, in this physical dimension, depends on how do we stimulate our body and our other non-physical bodies. Because if we admit we have the physical body, an energetic body, and an emotional or spiritual body, and a mental body, these four bodies are connected, deeply connected, and they transform the way our physical body manifests. And the epigenetics is the environment together with these other bodies and with our own consciousness, our intelligent principle, our self, ego, as there are many names that uses these bodies to manifest. So this is a very complex structure. Our health is the result of our consciousness. That's why consensual health. And as we are proposing, consensual health is the natural condition, a dynamic state of equilibrium or quality of the consciousness regarding their personal well-being. How do I feel? How do I perceive myself? Holosomatic homeostasis, how my bodies, my different physical and non-physical bodies manifests, and the harmonious relationships with this all-no-toe sense. Here we have the environment, because all-no-toe sense are the idea, our thoughts, our sentiments or feelings, and our energies are together. And we use this to manifest, and the places we go keep part of this toe sense. There are now an olo or a more complex holotrosen, and these all together constituting a resource for self-evolution. Here is very important to say, as you are talking before, Anna, we usually don't connect our worldview or our personal paradigm with our concept of health. It's disconnected. Health is something outside of me, or that I learn health is this way. And how do I live? How do I perceive? How do I organize my own life? Sometimes not so connected. So consciential health is about connection. Health as an expression of my own consciousness. And if we go further in the next slide, we can see self-care. So health and self-care together. Because self-care are the actions developed by a person for the benefit of their own life, health, and well-being, and that contribute to their development and aging. This is a scientific concept. And here we have an image of the 7 pillars of self-care, who are knowledge, mental well-being, physical activity, health eating, risk avoidance, good hygiene, and use of products and services. But there's something else we want to consider in self-care. We organize this idea in a different way to bring to you. We can see in the next as just 3 steps or 3 pillars that not exclude the others 7 we saw before, but reinterpret or distribute in a different way the idea of self-care in a self-care triad. So the self-care as this combination of 3 factors that relate and influence each other. One of them is self-knowledge, not about knowledge, but self-knowledge about how do I understand health, care, my purpose, what do I want to achieve, what is well-being for me, do I feel okay, how do I feel in my own life. The second is this cosmovision or worldview on health. How do we comprehend health? A critical view of the knowledge as a market, as a product, as a purpose, as a aesthetic influence. And the health technologies or practice or medical systems that are offered. And the third factor is the good use of these health resources. How do I apply this in practice? In how do I act about them? So what do I know about myself, about my own health and care? What do I know and perceive about the world and the environment, the energies, the dimensions, if I do admit them, if I do practice these experiences, and the resources I can apply. And we can go, is this okay until now? Because in next slide, we're going to see a tool we offer in our blog and here also that organize a self-care timeline. This is not a new idea, okay, organizing timelines, but the objective here, the goal is reflect about our own personal history in health and care. And we propose some questions, and in these 5 steps or 5 life times: childhood, adolescence, adulthood, third age, from 60 to 80, and fourth age after 80. And some questions everybody can answer to connect to their own history. This is the first tool we want to share, and this tool prepares ourselves to the next tool, our method. We organize. That is FEMA method. FEMA method is a method we propose, Marianne and I, in 4 steps: find, embrace, move, and again. And there are some differences between this method and other methods we also already have, but they are really deeply connected to the idea of integrative health. If we apply some integrative or complementary health or practice, probably you are going to recognize these ideas we are going to show here. The first step is the find. Find what? Find what is not okay and what do I want. Symptoms, discomforts, feelings, anxieties, diseases, illnesses, imbalances that demand attention, or interests, desires, and find also these resources, health professionals who can help, models or medicine health models, health rationalities that can guide this process of self-care, maybe help groups, virtual communities, or people related to the same problem. So we begin to organize the ideas and the feelings we have and the resources we have. The second step is embrace. Embrace as the idea of embracing as comprehending, understanding these symptoms, these situations, these changes, discomforts, diseases, insights, desires, without judgment or blame. This is hard. It's just easy to say, but it's really hard to apply because our culture, it's about who is wrong or who is responsible or whose blame is this. Mm-hmm. And in order to understand oneself and foster self-care, so it includes universal ethics, gratitude, compassion, forgiveness, and it includes consider this situation or disease you are living is part of your own history. It's not something apart, something outside. It's something is deeply connected to your genetics, to your epigenetics, your environment, your health, your family, your own abilities to deal with your own life. And
can we say it's also connected with our past lives as well?
Sure. If for who admits this idea of serial lives or sequential lives, for sure. And this is a big step, Anna. As we said, your concepts of health and care, a dialogue with your concepts of life, or it's apart. When I go to the hospital or to a clinic, do I keep my ideas of how my body express my own health, or no? It's disconnected. This is really important, because if I admit this condition, if I experience that, so it's better to embrace my own history, all these situations that now are expressed in this disease or these feelings or these interests. And we have a very normal common situation that is, oh, I'm sick. I don't want to be sick anymore. This is a real distorted idea. Not because it's not good to feel healthy. It's awesome, but we have a physical body. It doesn't feel okay all the time. It doesn't work okay all the time. We must comprehend this biological situation also and embrace this idea without judging and blame. And the next step, when I embrace my situation, I know it's mine. I must deal with this somehow. Then I try to move and not to cure necessarily, because we have a lot of problems that do not have exactly a cure in nowadays. The chronic diseases, for example. And move is rearranging or rearrange and recycle to produce the change. Any change, a small step, a different attitude every day to change the symptoms, difficulties, discomforts, or illnesses. Because as we said, self-care are the actions a person promotes. So move is making changes in these actions. And change starts by choosing new goals, targets related to our perspectives of health, physical, energetic, emotional, mental, spiritual. And the last step before we answer this question is again. Again is this is a non-ending cycle. So again is okay. I find out what's not okay about me. I embrace. I make changes in my life. I make movements. I got okay, but maybe in 2, 5, 10 years, this situation come back. And then I need to go again to the cycle because something changes. So we can
This
go.
is so important, I feel like, because a lot of people, they deny their problems, and they think that denying the problems are going to go away, but they are going to keep there dormant, and they are going to appear sometime. And it's also important sometimes to see the disease or the symptom as something that is calling us to change, right? And we have here one more question, which is what is your opinion and indications about nutrition? Is there any specific line that you would recommend? It's difficult to say now that everything has like a lot of agrotoxics and, but let's see what you can bring.
Oh, sure. I'll try to answer this question showing back the triad. So let's see. Mm-hmm. If we look the triad, we have the first self-knowledge. So do I know my body? How do I respond to different kinds of foods? How do I answer to agrotoxics, meat, dairy, food? So this is an important step because for some people, for example, I cannot eat soy. Is this correct? Soy? Yeah, but my husband can eat tons of it. So we cannot share soy products. And this I learned in a very experiential way. And other part are the cosmovision, this nutrition they are offering us. How much of this in a critical way is for my own health, and how much is for just for aesthetics. Aesthetics is important, okay, but it can't be above the physiology or the health we are we desire. And the last factor is resources. So this part of the question, is there a specific line that you recommend? I recommend you experience different ones, because I've experienced functional nutrition. It has a lot of good ideas, but also the dietotherapy from Chinese medicine, from Ayurvedic medicine, the fasting diets, and I now use a little bit of each one. As we have an integrative health, we can also have integrative nutrition that uses different parts to compose what is better to our own body, to our own consciousness. Mary, would you like to answer too?
Oh, it's a very good example that usually we have this question when we talk about the book, because nutrition is something that everybody eats, everybody is interested to learn what is best. And it is true, as Fernanda showed, the self-care triad helps us to understand what is that we want with our diet. With our diet is also something that we share with families, friends, and it is a social event. So we need to understand which of these aspects, self-knowledge, resources, and cosmovision, can help us. And also the other two tools that we have. So the self-care timeline can help, because our diet, our nutrition changes during the different periods of life. So if I was with a specific diet when I was an adolescent, it will be different as an adult and will change when I have third or fourth age. So I need to consider these aspects when I'm thinking about nutrition, and what problems, what conditions I have that I need to attend with my body, and to make exclusions or introductions. So sometimes people don't want to change their habits. It is very difficult to change. It's above our desire sometimes. So we need to understand in this timeline what we can do. And we can also show everyone here our second tool to help. Because if you find that you want to change something about your nutrition or about your chronic disease, maybe you can try to use what we call the self-care canvas. So we want to share with everyone here that this method, this 4-step method that we invite everyone to learn about today, the FEMA method, we organize in this canvas that is the Find, Embrace, and Move Again, but columns with questions that can help everyone. So, for example, we have here Evelyn that wants to know a little bit how to rearrange and recycle to change symptoms of chronic diseases. So maybe you can, if you want to, download this self-care canvas for free in our website, and then start to think about, okay, what feelings that I want to change or I want to address? What emotions, what specific illness that I want to address? And what therapies can help me? And which therapies do not help me, that maybe I have tried before and it's a strategy that don't seem to work. And I will show you an example how to, when it's these questions are answered, but what is that I tried and I like it, and maybe I stopped it because I didn't have the time or I didn't have the money at the time. But there are some things that we tried and then doesn't work. And as Fernanda said, the second step is the most important one, because if I don't embrace what I want to consider, address, usually the movement I do is very superficial. It's very not looking into deep what is happening. So when I invite myself to embrace, to understand what is the meaning of this situation in my life, sometimes a chronic disease appears when I have something going on with my life. What are the limitations of this situation? What happened? What changed in my life? And of course, what are the opportunities? Maybe I need to take care if I have, for example, one example of chronic disease is diabetes. And I had an opportunity to review my diet, my nutrition, the way I behave around food, or how I understand the food process. So maybe it is very hard, as Fernanda said, to embrace, because we judge ourselves, we like to blame, and it's not here something that we want to it's the person's fault, but it is somehow an opportunity for them to understand what's going on. So embracement sometimes will include forgiveness. It will include gratitude and compassion, that so much we talk about today about these feelings. So, and some books can help us understand what is going on, and some people always try to understand some diseases. So we invite everyone to take a look at this, so we can do a movement. We can do the movement. What change can help me reach my goal? What are the possible solutions for the identified situations? So what can I do now? How can I keep track of this? And then you can, combine with your family, with yourself. Sometimes we are so good to attend other people needs, but here we can make an arrangement that we will look at our movement, at our need, and maybe I can organize myself to do this. And the last part of our method is to start again every time we need to, because life is movement. The healthcare process is movement. It's always changing. Sometimes we would love the special pill that cures everything, or the aesthetic moment, but this is beyond our idea of health and care. And Claudia brings us a very interesting question. Does the gratitude means that I should be grateful for having a disease or a health problem? And usually people have this question also because sometimes they are like, do I need to be thankful? And it makes me feel so bad. I have so much problems. And what maybe we need to understand is the concept of gratitude. What is gratitude? What does it mean? So gratitude, if we look at the old concepts, when we think about meditation, when we think about traditional Chinese medicine or Ayurvedic medicine, that have this concept that everything happens for a reason, and everything, people don't like that very much. They're like, oh no, I don't like this concept. And what we invite here, everybody, when we think about the embracement or the gratitude, is when you think of a small child. And sometimes small childs, they cry for no reason. We don't understand why they're crying, and then they're crying very bad. And it's very hard for them to explain what's going on for them. Sometimes they don't understand also. And what we think about embracement that includes gratitude is sometimes we need only to hug that little child. Hug them and wait for them to calm down, and them to feel safe, and for them to feel like someone is there for them. So when we think about gratitude, we think about the idea of thinking the only idea that we are alive, that we have the opportunity to have family, or we have the opportunity to breathe. That's something that we have in meditation that is very useful. Okay, so I can breathe. I can be thankful to breathing or to being alive. And this idea of gratitude is much more than why I have this or why do I not have this. So it starts with this small comprehension of why everything happens all the time for somehow, some reason. So I don't know, maybe Fernanda wants to talk a little bit about gratitude too.
This is an incredible question. Thank you, Claudia, so much, because it's we can look the diseases or health problems in so different ways. So I don't need exactly. I'll talk about myself, for example, when I have a disease. Sometimes I'm not exactly grateful for the disease, but for the opportunity to learn with this disease, for the opportunity to see something I was not seeing before. For example, I'm working too much, or I'm some emotions I'm feeling, the anger I'm feeling about being sick, and how do I comprehend myself as perfect and always very well disposed, in a good disposition. And then this gratitude, it's up to you, because every person and every diseases, they are different. This is not the same, all the same. But I know a lot of people that are grateful for the diseases because it helped them to organize better their own lives, or to comprehend, or to make movements as, for example, reconnecting with some people, with family, learning to ask for help. That is really difficult in nowadays for our culture. So we have a lot of different emotions and feelings about a disease, and we can organize this in, for example, the self-care canvas, when we ask in the embracement step, what's the meaning, what's the limitations, and what's the opportunities, and it keeps all together. So I can feel anger about a disease, and also see the opportunity it brings me. It's okay. It's a step.
And it's
Very nice.
interesting.
I think diseases are kind of messages of things that we need to learn and things that we need to change. For instance, my field used to be cardiology, and sometimes I would receive a patient with a heart attack, and they were having like leading a crazy life with no time for family, just working, and just not paying attention in what they were doing daily because they were so overwhelmed with so many activities, and then going to the hospital and stopping for a week because they had a heart attack made them rethink their whole life and make a lot of good changes because life is short, and we have to reconnect with our priorities that sometimes just go out of hand because of all the crazy things that we have to do all the time, right? And if we don't lead a life connected to our priorities, it's not going to have meaning, right?
And this story you just told us, and it's something that we hear a lot in our classes, in our course, especially now that we are teaching about this method and this tool to healthcare professionals. They are telling us the same, because this concept, this idea, gratitude, embracement, is something that we are not exposed when we are studying, when we are doing our studies in healthcare. And they tell us the same idea, that they, for example, had an accident and almost lost their one of our students. It's a nurse. She have worked 20 years. It's the emergency care and also at the primary health care. And she had an accident and she almost lost her arm. And she realized that it was so different for her to be in the other side, to be receiving emergency care, and afterwards all the physiotherapy and everything that she needed to be back with her arm again and working. And then she realized that for the last 20 years, she did not see how her house would work, how her girls, she had two daughters, were growing up. And then this situation that at first was completely devastating for her gave her the opportunity to reshape her life and her work, and how she would be at home. And now she works from home and she sees her daughters every day and have meals with them. And she tells us that she's grateful. So maybe for ourselves, it's something that is like, well, she is grateful. This is amazing. Of course, she felt, as Fernanda said, anger. She did not understand. She suffered from it. But afterwards, she gave herself an opportunity. And that's why we include this step, the embracement step, in the canvas and also in the method, because we are beyond, we are much more than we understand at the first look at it, right? So we also have here for everybody an example of this canvas field. So maybe it helps if someone here wants to use the canvas, how they can organize. This is a very common example. It is headache. So if you have a headache, what therapies did help, what therapies did not help. In this case, the medicines that help sleep but did not diminish the headache crisis. And then she could only, go directly to the moving step, but she this patient decided to embrace and understand that part of her headache could be related to the way she was working and sleeping, and then how the limitation would be that she could not work when she had headache. So if she was overwhelmed, she could not work, and what could help her and help her to reshape, review her work and sleep routine. And then the movement she did was related to that. So she started to organize herself to work a minimum of 8 hour day and sleep at least 7 hour a night. Something that we heard about. There's a lot of evidence about the importance of sleeping and how much you work every day. And then she organized herself to do this. And then what she needed to do, reorganize agenda, negotiate deadlines. That is something very hard because we want to say, okay, I can do that, but sometimes we need to say, no, I cannot, I don't have time to do that, or I need to have my priorities on something else. And how she measures, so she kept a record. It's very, the person, it's amazing when we see people telling us how they use the canvas, that they do this in an intuitive way. Oh yeah, I start to organize my agenda with the hours of sleep and how I organize the hours of work. And then people usually they have this in their mind. We only help them to put in the paper. That's our goal here. And then in the last step, the again step, she understood that she reduced the number of headache crises, and she started to finish her daily tasks, and that gave her an amazing feeling of accomplishment. It was very good for her, made her happy about her work. And then what signs could send show that it was time to start a new cycle. And then when she noticed that she woke up tired, even she had 7 hours sleep, or she was too stressed at work, and that could be influencing her headache. And then she would organize a new cycle, a new canvas, organizing this new moment where she understood her headache in a different way. Maybe she could understand that this part of her body was too stressed, or she was too stressed, and then everything back on track, and then the canvas could still help her. So we invite everybody maybe to take a look at these tools that we just presented. They are all available in the website of the book, and you can go to them through this QR code, and or follow us in the social media, or find us at the website, and maybe share with us your canvas. That's why we tell everybody, share with us. We can tell this story to other people, because it's very important for people to understand this process is together. Everyone is trying to understand themselves better, take care of themselves in a different way. And here is some of our courses and our lives that we have been sharing this information. So this is what we wanted to share with everyone. And we thank everyone for their questions. They were very interesting. And we hope it helps everybody here.
Thank you so much, Fernanda and Mariana, for your great presentation. I'm so sorry that we are close to the end. I thank for your presence. I thank for your thoughts in this essential topic. And I would like to invite you guys for another activities that we'll have. We'll have the fundamental course of conscientiousness. That is an activity from reapprehension. And we have a short introduction here. So this program includes 20 classes, and it approaches bioenergies, parapsychism, out-of-body experiences, life programations, consciousness evolution, and quality of life. It's going to happen in a time that is very adequate for people in Australia. So in Sydney, it's going to be on Saturdays and Sundays between 10 and 12 p.m. And we also have another activities, which are our next lives. In August 27th, which is a Saturday at 8 p.m. Miami time, we are going to have Jacqueline Cohen and Fabiana Serrato talking about recalling past lives memories as a self-research tool. And also in the next Sunday, which is September 4th, we are going to have João Paulo Costa, also talking about past lives, how this research of our past lives can help us identify a broken line in our past life and how we can use retrocognitions in terms of tools for our consciousness evolution. So thank you for joining us today. Follow us in social media. Please subscribe to our channel. And happy evolutionary journey. Thank you, guys.